Let's shift our focus now to the coronavirus pandemic. Not a single hospital in the state of Alabama has an ICU bed available, and today the Alabama Hospital Association reports negative 67 ICU beds here in Alabama. WAAY 31's Olivia Schuler tells us more about how Marshall Medical Centers are managing the number of patients they're seeing and changing procedures to cope.
Outside the hospital, everything's just normal.
People on the outside don't know what's going on inside these hospital walls.
People are doing what they want, which is, fine. I mean, there's controversy around everything. But if I could give one message to the public, I would ask them to give us some grace.
Chief Nursing Officer of Marshall Medical Centers, Kathy Woodruff, echoes other health officials' repeated message: wear a mask, social distance, and wash your hands.
I'm not asking people to hunker down in their homes because that's not realistic, but a little bit of common sense, I think, might decrease some of the exposures that we've had, therefore decreasing the number of patients, that we're taking care of in the hospital.
Some of those patients being cared for need an ICU bed, but since there are none available, that's where Plan B comes into place.
We're holding several ICU patients in our emergency departments, and what I mean by that is these are patients that need to be in the ICU, but we don't have any ICU beds, so therefore they stay in the emergency department as an ICU patient.
Woodruff says the two hospitals aren't at their breaking point right now, but they're struggling to continue at the current pace. Reporting in Marshall County, Olivia Schuler, WAAY 31 News.